Well, good evening, everybody, and welcome to yet another ISR online event. We had so many this year. I think we've done more events this year than when we used to do them in person. So it's really great that you could join us this evening. My name is Jo Crotty and I'm Professor of Management and Director of ISR, or the Institute of Social Responsibility here at Edge Hill. And it's my great pleasure to introduce you to our Knowledge Exchange event this evening on sustainable urban futures. We've all had an interesting year, and like me, you've probably discovered new walks and new parts of your urban environment that you never knew existed. And so hopefully we're going to explore this evening and how this actually relates to the issue of migration and asylum seeking. This is a shared event between the Northwest Migration Working Group and SustainNet. And so without further ado, I'm going to hand you over to the director of the Northwest Migration Group, Zana Vathi, who's been working with ISR for the last year as one of our research fellows. So over to you, Zana.
Thank you very much, Jo, and thank you to everyone who's joined us today. We're focusing on the impact of COVID-19 on asylum seekers and refugees in Liverpool, and we have a very interesting set of speakers, so thank you to all speakers who joined us, even though we are still affected by the pandemic. This event is indeed a continuation of the long-standing work that the Migration Working Group based in Edge Hill has been doing on migration issues in the Northwest for the past for a number of years, 7 years now that we are actively working on very different issues and typically engaging different stakeholders as well. The event itself aims to discover to what extent we could utilize the knowledge we had on the way asylum seekers and refugees experience life in the private and public spheres and how the pandemic affected that. More specifically, we want to hear from different stakeholders what narratives, but also what policies, what programming, what methods of working developed within the framework of urban diversity during COVID-19, to what extent asylum seekers and refugees' vulnerabilities transform as we come out of lockdown, and what opportunities for learning did the pandemic create, and how we can harness that learning for a better experience of asylum seekers and refugees. We approach this through the broad framework of sustainability. We are indeed interested in understanding how we can optimize the support we provide to asylum seekers and refugees, who are some of the most vulnerable members of our communities. This approach to sustainability itself must have changed as a result of the pandemic. So on that note, I invite Professor Christopher Dent to share some thoughts on this, on our approach to sustainability as the leader of SustainNet, another group based in Edge University. Thank you, Chris.
Thank you very much indeed, Zana and Jo, for those introductions. Yeah, it's my great pleasure to be part of this event. Zana was one of the very earliest, I think one of the founding members of SustainNet that was it's formally been around since February last year, but we actually started work on trying to develop a new sustainability initiative at Edge Hill University back in the kind of autumn of 2019. And Zana's been at the very beginning of that whole process. So I'm really glad to be able to talk to you a little bit about what SustainNet does and to set some context. So as we know, sustainability is a very broad kind of concept, and it relates to multiple challenges facing humanity, both locally, nationally, and globally in the 21st century. So, you know, one of the things that we do in SustainNet is look at various kind of social, if you like, aspects of sustainability, about community. And what we're trying to do at Edge Hill University under the ISR and SustainNet is part of ICR, is to try to develop network communities around the ideas of sustainability. So this is a really important venture actually for us. We are working across 4 broad kind of agendas in SustainNet to try to advance the sustainability agenda, not just at Edge Hill University, but also in our local area and local region. So those 4 areas are research, education or education for sustainability or sustainable development, student engagement, and local partner and local community engagement. So SustainNet now has 50 plus staff members and 30 student members. In addition to that, we have 30 partner organizations that we're working with locally to develop a broader kind of network community on sustainability in our regional kind of locale. So what I'm going to do is, can I just share my screen and just share you just very briefly where Sustainer is on the interweb, internet. This is our website. You can find out more about our work through looking at the various pages and who are members of it, the events we get up to. We've run quite a successful webinar series this year. And then you can find expertise and interests around the different kind of 6 clusters of expertise we have on sustainability. So those are the kind of clusters listed there. And if you go to the partners webpage, you will see the list of around 30 different local partner organizations that we work with, which cover a very broad spectrum of sustainability kind of activity and action. Now, I'm really hoping that Zana's work here will provide us with a much stronger platform moving ahead, going ahead with working with sustainable futures for refugees in our local area. So that is all I'd like to say at this stage. Thank you very much for this opportunity. I'm now going to pass you back to Zana.
Thank you very much, Chris, and I'm very much looking forward now to listening to our speakers. We start with Janine Antiga, who is Program Officer at the Community Cohesion Team at Liverpool City Council. She will talk about the way that the Liverpool City Council has tried, and I hope succeeded, to implement our Liverpool strategy during lockdown. And over to you, Janine. Thank you very much.
Thank you very much, Sana. Hi, everybody. My name's Janine Antiga. I am Community Development Officer based in Liverpool City Council. What I'm going to do really, first of all, is tell you a little bit about the Our Liverpool strategy. I'm going to put the link to the strategy in the chat after I've finished speaking. So if anybody wants to download it, or if you also have any questions afterwards, please feel free. Our strategy was launched in 2018 now, which was supposed to be a strategy which encompassed Liverpool into being a more warm and welcoming city for people who were seeking asylum, who had their refugee status, but also vulnerable migrants who we realise have got an exceptional way of, they need some extra support so that they can rebuild their lives from the day that they arrive. So we have 4 overarching outcomes, and it's around people feeling safe and welcomed, and that they have got the opportunity to live in cohesive communities and to build on the diverse relationships and connections that they have. Also, as well, the second one is that they understand their rights and responsibilities and entitlements, so that they're well informed and they understand what they can and can't get when it comes to being part of our Liverpool community. Also, as well, we wanted to make sure that people have got access to well-coordinated services, and that people recognise what their needs are and what their rights are when it comes to that. And then the very last is that everything that we do in terms of our policy and strategic planning is formed with the needs of people at the heart of it. So it's informed with their rights and their needs and their aspirations, and we build our strategy and our planning around that. So as you can imagine, we had all these fantastic and wonderful projects. I know there's a couple of people who the Our Liverpool programme of funders that you're going to hear from. Absolutely wonderful organisations, and during COVID everything kind of paused, and if you can imagine how scary it was for even us whose first language is English and we understand where to get information, people who were in the asylum process or maybe have just got their refugee status were probably in a situation where they didn't have access to that information. So the start of what we tried to do was really focus on 2 things: their access to information and their access to support. Now, we did a wide range of stuff, but I just thought I'd pick out some key things that we did that may help you to understand where our heads were coming at. Access to information first was we were finding that everything that was coming through right at the beginning of the pandemic and the lockdown was all in English. It was all in very high level English as well, so it was really hard to digest. So pretty quickly we mobilized, and we got together a bit of a Facebook group where we invited all of our community partners who we couldn't have done anything without the help of our community members, because the key to a really successful strategy, the Our Liverpool strategy, is at the heart of our support organisations. So we mobilised pretty quickly to have a Facebook group, and if any of you understand the local authority guidelines around access to social media, you can understand why this was quite a big win for us, because usually it's managed by corporate, so corporate comms team would manage all our social media, but they allowed our team to have a group where we were able to put in loads of information. So we were pulling down information from Doctors of the World, from all our community partners, making sure that it was translated into their community languages. And then partway through lockdown and the pandemic, we had a bit of a small spike of cases, which some of you may be aware of, may have seen it in the newspapers around the Princes Park ward area of the city. Now that was a city which is highly populated and a high dispersal area for people who are in the asylum process or have got their refugee status. So what we did during that time is ensure that people felt protected, they felt like they had the information, and we coordinated with the community to have videos in community languages. So it's videos of people that they trusted within their community, and they were short videos that we were able to share on WhatsApp and to get all that information around, which was a really, really key thing during that time, and it helped, I think, alleviate some of the issues, and the spike was able to level off and go back to the normal rates that it was in the other wards across the city. And then a key thing as well, what we did is the Mayor Anderson at the time, he wrote to every single resident within Liverpool a letter when we went into tier 3 lockdown, and you may, if you're a resident of Liverpool, may have recalled getting a letter from the mayor. But what our team did is we made sure that everybody also who was in the asylum process, who had got their status, all got letters that were translated in their home language, so that they were fully aware of what we were doing in the city, where they could go for help. And that was a really key thing when it comes to access to information. Now, when we go to access to support, that was a really trying time for people, because they were losing access to support agencies who their doors were shut, access to food provision. So what we tried to do in our team was to make sure that people understood that if they were no recourse to public funds and they were out on the streets, that they had access to housing support as part of the Everyone In process. As part of the food provision, we had a community helpline where people could phone in and say we're struggling for food, we haven't got access, and they could also do it within their own community language, and our team would call them back with a translator, but also ask about housing. We would ask about whether they had access to information, we would ask whether their children were okay and they had enough provision for homeschooling, they had digital access. So it was kind of a wraparound care that they got. At the moment as well, we're making sure that people have got adequate access to the vaccine and testing. So we did a pilot project where we went into all the initial accommodation centres within the hostels within Liverpool, and we gave everyone information within their own languages. We brought interpreters, and we just really talked about the vaccine, about how they can access it, especially if they haven't got access to a GP, which is a really important way of accessing the vaccine if you were part of the community. But if you're just newly arrived, you wouldn't have access to a GP. So we made sure that we gave them that information, and also as well when it came to testing. And then if you may have recalled through the media as well, we had free school meal vouchers that were sent to all families who were eligible. But during the pandemic, there was a certain group of people who were no recourse to public funds. So that would be if their asylum claim had failed and they were on Section 4 support, or they were vulnerable migrants and they may have not been able to access work during the pandemic. We were able to draw down, the government set out a new procedure that people could have access during that point. So we work really closely with our children's services team, and we literally called everybody who was getting Section 17 support on social services books, and we made sure that they got free school meal vouchers, which at that time destitution was really high within the community, so we needed to make sure that everyone had fair access to that. Now, these are just a bit of a picture and of all the different support services that we have in Liverpool, and a bit of a shout out to all them, because without our partners, the people who were in the asylum process or did have refugee status or vulnerable migrants would have been in a much difficult position that they were at that time. So this is just a couple of pictures for them to say thank you very much for all your hard work during the pandemic. It has been very difficult, and we're looking forward to seeing how we can now work together to come out of the other side and make sure that everybody has got equal and full access to services as well afterwards. So here's my contact details, and I'll stop now, Zana, and if anyone has any questions, please feel free.
Thank you very much. Thank you very much, Janine. So our speakers have only a 5 minutes presentation time and 5 minutes Q&A. So everyone who has questions, you are welcome to direct them to the chat, and I'll read them out. In the meantime, I would like to start with a question for Janine. A lot seems to have happened as part of your services. Can you comment a little bit on your resilience and how you managed to coordinate? What was your way of dealing with all the potential chaos that might have been created? How did you deal with the challenge?
That it was quite hard, and probably everybody else was feeling that same situation. But we have really good community networks, and we have really good partnerships, and I think that's what helped us. So when a service, even at the moment, some services are feeling really overwhelmed, so the coordination of another service will then take over that, and we all just really spoke to each other. I've got a really great team, like these are my colleagues, Ellen, Phil and myself, and we really coordinated within ourselves so that we made sure we weren't feeling overwhelmed, and that overwhelmed feeling wasn't translated into our communities, which was the key.
Okay, so if there are no questions at the moment, I would like to thank Janine. Thank you very much. And I invite now Dr. John Reynolds, who is a GP in Liverpool and has been working at the Asylum Service for NHS Liverpool during the pandemic. John will speak for 5 minutes, and then we have an opportunity to ask him questions. Following that, please do post your questions in the chat, and I'll make sure that they are, they are directed to John after his presentation. John, over to you.
Thank you very much, and thanks for the invitation to this. I will try and be quick. I've scripted myself, so hopefully I'll stick to 5 minutes. Just a little bit about myself, just so you know who I am. As has been said, I'm John Reynolds. I'm a GP. I'm also clinical lead for PC24's Liverpool services. We run various things in Merseyside, urgent and routine general practice, and that includes out of hour services, extended access, urgent general practice in the A&Es, and the Liverpool Asylum Medical Assessment Service. And that's obviously the reason why I'm here. Just as a bit of a summary of what we offer patients, we're not a full GP service for asylum seekers. We offer initial health assessments to all adult asylum seekers when they arrive into initial accommodation. We also, on top of that, offer some urgent healthcare, but primary healthcare until patients move on to dispersal accommodation and register with normal general practice. We don't offer a full array of general practice services, and our service is set up very much to offer a specialist assessment, and in normal times patients would stay with us over, say, 4 to 6, possibly 8 weeks, and then move on to dispersal accommodation, and at that point be able to they would register with normal general practice and have the full array of services. Alongside us, from a medical point of view, there's input from the Child Health Inclusion team, which is run by Merseycare, and they include giving childhood vaccines. There's also a TB screening service, which is run by Liverpool University Foundation Trust, and we also have access to short-term counselling, which is offered through our Burley Court building. Now, I came into the service, into this part of our service right at the start of the first lockdown. I'd had no experience of the asylum system, and to be honest, what I found was a system that was pretty much ground to a halt when COVID had hit. Asylum seekers were still arriving in the UK, moving into IA, but they weren't moving into dispersal accommodation and not really being integrated into our communities. The number of IAs was essentially increasing. Serco, who are the accommodation providers, they were taking on various hotels in the northwest, and on top of that increase in patients that were being held on our books, we also found that, obviously, we found that consulting was a lot more difficult, and we were consulting remotely, but patients, especially asylum seekers, did have problems with access to IT and phones. And even when patients did have access to phones, often phones were shared between families, and numbers were changed pretty frequently. So internally, we looked at ways to consult with patients, but there was a much bigger piece of work across the asylum system, looking at a whole host of problems which Janine has gone into, as far as things like communication, food, translation. There were a whole host of things, and what happened was early on we joined together with Public Health Liverpool, the council, Liverpool CCG, Serco, NHSE, the Home Office, and then other organisations like Migrant Help. And this got us talking, highlighting issues, finding solutions. And without that team effort, essentially nothing would have got moving. And certainly we wouldn't be in the position we are now. I jotted down a few sort of key developments, which Janine's actually mentioned, and I think that sort of highlights some of these as being really important things. So for us, we moved to a predominantly remote assessment service. We had staff in PPE with mobile phones, basically going to accommodation sites and making contact with patients. We could then have 2- or 3-way calls if interpretation was needed, so we could do remote assessments. That ensured that we were fulfilling what we needed to do as far as assessing patients' health needs. We worked closely with the social inclusion team to register patients with local general practice. Patients weren't moving through the system, so it wasn't following the normal route. But obviously, with us not being a general practice service, we weren't able to arrange things like long-term chronic disease monitoring, long-term prescribing, routine vaccinations, or even things like screening services like cervical smears. So it was very important that we were able to find the patients who needed these services and prioritise them with registration with general practice, and the social inclusion team helped us with that. We also then started looking at age groups and arranging for them to be registered. Council and Migrant Help plus other people were involved in a lot of translation of information. As Janine said, information was coming through in English, And yes, it probably not written for everyone to be able to read, and so that needs to be translated. It needs to make sure that that all patients were able to access information. We arranged some distribution of face coverings. Asylum seekers don't tend to have a huge amount of spare money to buy face coverings, and oh, 2 minutes left. I've just seen that. I'm sorry. I'll be 30 seconds. So again, it was a need. We got face coverings distributed, and we also, Janine's mentioned this about sort of food and medicine for people that were in isolation, and ensuring people weren't going hungry, were being able to access healthcare. At this point, we've seen patient flow through to DA, dispersal accommodation return, but it's still a work in progress. We're not back to normal, as the rest of the country isn't. And I will stop there so I don't get told off for overrunning too much.
Thank you very much, John. I will start with a question, and I invite everyone to post questions on the web. You did mention quite a few issues, and you also referred to Janine's presentation, and she also mentioned quite a few issues. From a health and well-being perspective, what would you pick? Which would you pick as the most problematic aspect that affected asylum seekers and refugees during the pandemic?
I think just accessing healthcare. Asylum seekers have a right to register with a GP practice, but historically what's happened is we've taken on their care for that short period of time, and it means that patients don't have to register with one GP practice, and then 6 weeks later they move to DA in another area and have to register with another GP practice. It also means that we can give a specialist assessment of their health needs. We can look at things which most GP practices wouldn't be asking questions about, and we can then pass that information onto the GP once they register. So in normal times, that seems all quite reasonable. Come into the country, you have a specialist assessment, you then register with a GP. They've got access to the information which is there, and any more urgent health needs has been taken care of by our service. But what happened as soon as COVID hit, people weren't moving to the DA, so they weren't then registering with general practice, and it took, to be honest, it was something which didn't happen straight away. We realized that was an issue. Patients in the past, we hadn't been holding on to them for that long, so it's getting them access to normal general practice in a timely way. And I think you can also talk about things like dentists. We've done some added some questions to our assessments about dental problems, and I think this is off the top of my head, so forgive me if it's not accurate, but it's something like 30 or 40% of our patients have some sort of dental problem, and some of those are quite significant. So dentists pretty much closed their doors when COVID hit. It was hard enough for people who are used to a UK system accessing dental services. So on top of that, you then had language difficulties and not knowing the system, and having higher dental risk. So that was a problem. So just accessing healthcare, it's hard anyway, and it got harder.
Thank you very much. And accessing is not just a simple matter. Accessing is an umbrella term for many other aspects that relate to asylum seekers' lives. So thank you very much, John. I wish we could speak longer, and hopefully there'll be other opportunities to talk more about this. Now I would like to invite a presentation from community projects, which are funded by our Liverpool strategy. We had communication with another speaker without wanting to spoil the presentations from the two speakers that are present. The Family Refugee Support Project did communicate, did send some input, and it was very telling to see how their service had to change quite a lot during the pandemic, how it had to go completely online, while normally it's supposed to be psychotherapy in open areas, and also highlighting what issues they had to go through with asylum seekers, some of them also falling through the cracks of the system if they were rejected, if their asylum claim application was rejected, and they had to deal with survival issues when it comes to providing basic help such as food parcels or shelter and so on. So I'm very much looking forward to hearing from our speakers today. And I start with Ben Meller, who is a representative of Collective Encounters. Ben, over to you.
Hi everyone, sorry, rookie error, I was still on mute. So yeah, I'm going to try and give a really quick sort of potted history of our work with young people seeking asylum and with refugee status in Liverpool over the last 3 years. So apologies if I speak a little bit too fast. I'm going to actually set a timer, there we go, so I don't go over too badly. We are a Theatre for Social Change company who have been going for about 15 years. We work with people of all ages to enable them to tell their stories and achieve change. And we have a youth programme which I've been running for the last 5 or 6 years, which is funded by BBC Children in Need. The youth programme consists of a weekly youth theatre who meet every week and make a production every year and go on theatre trips and other cultural excursions, and also a range of outreach projects throughout the year targeted at sort of specific kind of groups or communities of young people. So in 2018, we started working with young people in exile in Liverpool, and we piloted a project called Where You're At, which was just a 1-week intensive summer half-term programme with recruitment partners, including City of Liverpool College, who were the sort of the main source of young people on that project. But we also had young people referred through housing associations and other charities and NGOs. And the programme included drama, spoken word, storytelling, music production, rap, singing, dance and movement, so that we could sort of employ non-verbal languages as well as art forms that required the use of English. And that was a hugely successful project, both in terms of sort of recruitment. We had over sort of 20 young people through the doors over the course of that week, but also more importantly for retention for our core youth theatre group. It went from being a kind of very monocultural, almost completely white young people from Liverpool to being a very multi-ethnic, multicultural group with young people from all over the world, and who integrated really quickly and really well, became very good friends with each other. And we started exploring the theme of home that year and in our regular workshops, and we created a show called The Street Where the Stories Live, which explored some of the young people's experiences of migration and also other sort of issues of identity and the stories that they wanted to tell and the change that they wanted to make and see in the world. This is just a small selection of images from that time. This is a post-show meal. We shared some food during our creative process and told stories that were connected to food during the process as well. And we met a Brazilian theatre company who came over to visit Liverpool called Coletivo Ocupação. Amazing time with them. This was a theatre trip. So yeah, a really lovely time. And this became the kind of unofficial logo of the group at that time. This is the thumb thing, which we do as sort of feedback at the end of every session. People put their thumbs into the middle and throw thumb thing into the middle that they enjoyed about the session. And that photo just kind of became a bit of a logo. Oh, my background is from the Street Where the Stories Live show as well, by the way. So in amongst all of that, whilst that was still going on, we received funding from our Liverpool to develop a 2-year programme to expand the project. So we did a 2-week project in the summer holidays in 2019, which was, to be honest, less successful in terms of recruitment and retention, but still very useful. And we did manage to deliver some arts awards on that project. Everyone on the project went away with a Bronze Arts Award or a Discover Arts Award. And then, so year 2 was supposed to be last year. We had planned a 2-week project in the Easter holidays, which obviously got canned as soon as the pandemic struck and we locked down, and pivoted all of our delivery with young people into online workshops and projects. So Where You're At became one of our online Bronze Arts Awards projects last summer, with 8 sessions delivered over 4 weeks, really sort of focused on achieving a Bronze Arts Award. Again, multi-art form. We worked with drama, poetry, music, and the benefit of that was that it was a lot cheaper to run online, so we ended up with a bit of an underspend. So we actually ran a second program towards the end of last year and the beginning of this year, which was more focused on creative English teaching through drama. They were both very successful projects in and of themselves, and with successful kind of creative outcomes and feedback from the participants, but they were both very much harder in terms of recruitment, I think. Oh, and this is, oh, that's my timer. There we go, I've gone over. So yeah, we've got some more funding from Arts Council to develop our delivery in this area with 18 to 25-year-olds, and we're also hoping to do some more delivery with our final current funding of children in need with 13 to 17-year-olds. But just really quickly, the issues that we faced, I've already talked about the fact that attendance, it was really noticeable with our core group that the ones who weren't coming to online workshops were those from migrant backgrounds. I think because of language barriers created by online workshops that necessarily rely more on verbal language and text. A lot of our young people went into sort of full or part-time work, especially over the summer, with like Deliveroo or working in takeaway restaurants. Others had sort of school and education work to kind of keep up with, and which, when that was online, you were also sort of facing Zoom fatigue and people not wanting to come along to an online session after spending their whole day in online lessons. Access to the internet is obviously a big issue, especially if people are living in chaotic housing conditions, or we've got young unaccompanied minors sharing a house and sharing a Wi-Fi connection. Even if they've all got a device to access a Zoom call, the Wi-Fi wasn't up to having 4 people on Zoom all at the same time. So you'd have like 4 people on a laptop trying to crowd around and do the same session, which was difficult. And of course, mental health, loneliness, isolation has impacted so many people during this time. But I think particularly with young people who are likely to be more prone to those issues through trauma that they might have experienced in their childhood and adolescence, then even though what we try to do is to sort of to provide creative outlets and ways to sort of remedy some of those issues, obviously experiencing them in the first place can be a barrier to sort of accessing things that might help to improve them. So those are some of the issues. Those are my contact details if anyone would like to find out more about our work, or contact me directly to speak about our work with young people. Yeah, I probably haven't left any time for questions, sorry.
No, it's okay. I'm fascinated, to be quite honest with you and everybody, to see what you have been doing before the pandemic and how you've managed to keep your work going, because we know from literature, from the way that we work, that engaging creatively for young people is essential for their expression and for the development of their identities. But when it comes to migrant groups, this is essential for their survival, especially in the early stages, because it helps them to create social connections and to feel safe with others. So I'm quite interested to know whether you experienced any issues before the pandemic, and also if this continued during the pandemic with specific groups, or did you have any hard to reach groups or individuals who comes to your organization, and how they are referred to your organization?
Not really. I did notice, especially in the sort of the second year of our Where You're At delivery, or the first year of our Liverpool funding, we did have young people from Vietnamese backgrounds who were sort of harder to reach, just in terms of they seem to have lower levels of English, or they were just maybe more newly arrived, we had an issue during that project where one young person was kind of he was moved from a he was in a supported accommodation there was 4 lads from that background, and then but because he was under 16, he was sort of moved into foster care, and it was sort of right in the middle of this project. So, you know, he had to kind of come and be sort of literally like taken out of a workshop and kind of moved to a foster care home like up in Southport or something, you know. So it was really traumatic for him, kind of having sort of, you know, come here, found a group of friends in this children's home, and then suddenly been ripped out of that and ripped out of our project and taken off. So that was that. Fortunately, the foster placement that he got put in was were very helpful and you know, made sure that he accessed the rest of the project, but it could have gone a different way. So I think, you know, yes, there's obviously different experiences with young people from different countries and different backgrounds, but I have noticed that those young people from Vietnam and that sort of part of the world can have more sort of transitory experiences, or you know, can be harder to reach for whatever reasons.
Yes, thank you for sharing that. One of my impressions is that one reason would be that they have no existing ethnic group, or there isn't a community for them already in Liverpool or in the Northwest, which could in a way assure them that there is someone, you know, they can reach to in their language and so on. And this usually plays a role, even though you know, from one presentation to the other, and from what we learn as well from what people tell us when we do our research, the asylum system is not particularly friendly. So just taking people from one accommodation to the other as soon as they have created a contact is very disruptive and very definitely harmful for their social inclusion where they live. Mm-hmm. So on that note, I would like to hear from Adele Spears now, who is the representative of Solar Arts. And I hope that she will have more to say in terms of day-to-day experiences of asylum seekers and refugees in Liverpool during the pandemic. Adele, over to you.
Oh, thanks, Anna. Thank you. Hi everyone. So I was going to be doing whiteboard, but I decided that was a little bit too creative for my day to day, which has been quite busy already. So I'm going to be showing you a slideshow to kind of give you a flavour of what we do. And hopefully I'll be able to keep to 5 minutes, but like Ben, we'll probably have a bit of a stopwatch going on to remind me, because I can talk. So I'm the Managing Director and Senior Art Psychotherapist at Solar Arts, and just to give you a very basic understanding of who or what Solar is, as it says here, really, we're mainly participant-led charity based in Toxteth, been running since 2004. And our main remit, but not exclusively, has always been to support people from asylum seeker and refugee backgrounds, and support people through a range of opportunities, which it starts nowadays with a therapy intervention for some people. We have a social support, so we have a social worker based here. We have 2 art therapists, art psychotherapists, and a child and adolescent psychotherapist. We have lots of different skills development programs. We have evolved a festival called Festival 31, which happens annually since 2014, which is very much about working with partners and individuals in the community around refugee themed program of exploration, understanding the refugee journey. We have employability, and we have enterprise, and our main support is around arts and mental health, but also integration, opportunity, and enabling somebody. So we always say that we walk alongside of somebody. We don't hold somebody's hand. We enable and empower people to make choices, and where choices are taken away from people, we sit a real journey with them. Okay, so for Solar, what's really important is our shared space with each other, and for many people, the sense of being part of a community and being part of a network of people who may not have family here. And so we We have a lot of feedback that we form our family here. So one comment that somebody recently said was that it was a beautiful comment. He is a philosopher, I must say, the person who's originally from a Persian country, and he said solar is like honey that you put on a wound, pure honey that you put on a wound, and if you wait it will heal. And I thought that was a really lovely way of commenting on the work that we do. So I'm just going to narrate briefly about some of the changes that have happened for us in the past 12 months. So we'll say that, well, since March 2020. So March 2020, we had 6 part-time members of staff and 1 full-time. Now we have 11 part-time members of staff, including, 10, including 1 full-time. So my narration is going to show how much actually our work has expanded, and funding has been really key, as working mutually, as well as working mutually with other groups and organisations locally. So one of the first things we actually did was went online, as most people have, and that was a challenge for ourselves. We are representative of the people we support. So we work with people whose families have English as a second language, which means that their children might not be able to speak English to access school online, or they may have recently settled, or maybe volunteering and be seeking asylum themselves. So it was quite a challenge for us to become online, whilst also working face to face with people. So as a therapy provision, we were able to consider whether we were frontline or not. And initially we didn't start recognising ourselves as frontline, but what we did decide to do was to start to reach out to people and enable our participants at the time to actually access online resources. But at the same time, we started doing emergency support, supporting people to get to hospitals. One guy broke his arm, needed to get to a hospital, didn't have the money, didn't have any way of getting there or support to navigate that system, getting food out to people, getting people online. So getting information about COVID out there was really important. We also encourage people, and I know that I've not got much left on my time, so probably like Ben might go over a minute or two, but we also encourage people to get out for their walks and to take part in what was happening in society. So looking out, finding their rainbows, sending them in by WhatsApp to us would be fine, because we were providing people with data costs, with data money, data budgets, also exploring what was in their local environment. And we started connecting, there we go, we started connecting with nature straight away for people. We did face-to-face door visits as well as the emergency support. We were started to run art groups and art therapy online, and going out and giving art supplies to people and enabling people to engage with us face-to-face at door was really, really important. Okay, so we continued that, and we took a lot of our activities online. One of the main programs that we had running through, well, several, but one of them for families was the family program with Everyman and Playhouse Theatre, and this is Laura from Solar running some creative groups, okay, for that family program. We took Festival 31 online, but we didn't exclusively say that Festival 31 was going to be running just online. We tried to see if there were ways that when people were able to get out again, that they could connect through social distancing for activities. We found that people who are in art psychotherapy, which is a normally very closed group, actually wanted to show their work, which is really unusual, to try to connect with people. And so we have had some sharing of art therapy work online, and we've also changed the way that we work to look at expressive groups rather than art therapy. So we've looked at a psychosocial model. This is one example of how Festival 31 actually brought people together, and that's kind of our ethos. We started to show people that you can very safely link when we were able to start to deliver therapy and start to encourage people to come back to meet us. And we took the opportunity to develop ESOL classes and to kind of enhance our work. One thing I want to say just before finishing is that I just come back to main screen on myself, is that we have adapted. We've never stopped face-to-face work. We started delivering one-to-one therapy last October, and we have always tried to do walk and talk where possible with people. We have been able to get digital with people, and we didn't do it through we didn't do it through Wi-Fi facilities that people may have, because they don't have it within their homes necessarily. But what we did was showed people how to tether their phones to digital devices we gave them, such as tablets. And what that has done quite significantly is enabled us to support people who, since lockdowns ended and they've been dispersed, or during lockdown have been dispersed outside of Liverpool. We've been able to enable people to continue using those devices and connect with our services during lockdown continued, such as ESOL classes or therapy, etc. That's been quite a significant shift. There's a lot more I could talk about, a hell of a lot more I could talk about, such as getting people into employment and other areas. But that's just a little snippet of some of the kind of changes and activities that we've had.
Thank you very much, Adair. Quite fascinating, and I'll be quite interested to hear a bit more on what you said, that we became more frontline. We had to adapt, and we had to reach out a bit more. And what fascinates me more is how people who come to your services are quite vulnerable, but instead of becoming more insular and more closed during the pandemic, they actually shared more, that wanted to make their creation more visible to others. So some comments on that would be very helpful.
So one of the first things we did was we decided not to become insular through COVID, and we decided to keep that as a bit of a path really that we'd support other people to have as well, because with mental health difficulties of the people that we support, it's very easy to become very internal and go into a very small space within, I guess, and not venture out or feel fear of venturing out into the urban environment. So we quite quickly linked with mutual aid groups and started doing food bank deliveries, and we very quickly realized that we were reaching new people, reaching people we would never have normally reached. So we linked with them. It's called Love Liverpool Food, who were doing hot food, and we said, well, if you do hot food for people, we'll do the food bank collections and we'll distribute the food for you. And we within a week we were distributing food to 350 people every week. It was a big shift for us in how we reached out. I think the main thing in terms of people sharing was that they felt that they could reach out as well, yeah, and that was essential for us to find ways, to find avenues to enable that reaching out. And it was a constant shift and quite exhausting to explore how to do that really. As a team, we were reaching out to each other because people were poorly. We had families from our team, families who had COVID, you know, who were poorly themselves. We were needing to look after ourselves and have self-care. We were on, what I think is really important to narrate in this, is we were on not the same, but some kind of a parallel experience now, understanding simultaneously that we all felt under threat. And I think that was quite an important and interesting part of the journey through COVID. So for us, it was about enabling people to share as much as possible, and people wanted to do that, yeah, in lots of different ways. I don't know if I've answered your question, but
yes. We only have 3 minutes left, and I would like to invite all the speakers today with a common question. What do you see as the main lesson, or the key resources, or the intellectual capital that you as professionals developed during the pandemic that could be helpful as we come out of the pandemic? Because we are not going back to normal. That is just, you know, it's a myth which we all have cultivated during this year, but there will be changes ahead. And I was wondering whether there are learning points that you would like to take forward and to probably invest in your work and harness the learning of the pandemic. Yes.
Should I go first? I was just actually typing something about, sorry, I type in the chat quite a bit. I mean, a learning point is how communication is so key to things. That's communication between services. And I was just typing a little bit here that what I've seen is services link up because of COVID. Services and organisations linking up. There's been a lot. There's been a sort of a mushroom of communication happening, but because we've been working virtually, it's actually made it easier to a certain extent. We can have a meeting at 9 o'clock on a Friday morning between lots of organisations because people can log on. If certainly when the first lockdown, most people were, or a lot of people were, working from home to a certain extent, and these things could happen. So I think certainly going forward, I would want that collaboration. I would want that communication to carry on. I like meeting people, but I think we need to carry on with a certain amount of virtual meetings as well. I'm sorry to say that, but I think that we've seen the benefits of it, but there's also benefits of seeing people face to face. I do miss those interactions.
Excellent. Any other reflections from the other speakers?
Yeah, I'd just like to sort of second that, John. I think that, you know, one of the things I haven't talked about tonight is the positives of working online, in that with our main group, it's enabled us to reach young people who live far outside of our usual geographical boundaries, and it's enabled us to reach young people who wouldn't normally get on as well in a room. And you know, it's been really good for some young people being able to access our offers, our creative offers online. But it's been really bad for other young people, and particularly young people, it seems to me, from migrant backgrounds. And I'd just like to, we're working on trying to explore how to bring those two things together, and how to, without doubling our workload, trying to you know, maintain our connection with the young people who thrive in online environments, and also those who thrive in physical environments.
Any other comments from the speakers that you'd like to add?
Yeah, I mean, I agree with the from a professional's point of view, being able to come together. I think anything that cuts down the travel, that makes the rest of the day cluttered, is really, really helpful. Yeah. I think that Zoom has become a bit of a great thing for us, but also very, very exhausting. I think what we've learned from the people that we support is that they're very, very used to using digital communication for being in contact. So where they can be in contact with family overseas, using WhatsApp is not an unfamiliar format. And we learnt a lot from the people that we support in how it's okay to be online in communication. So I think for me, there's something about reinforcing what we can learn from the people that we support to educate us as well, and to enable what we do, and making sure that it is always very much focused around the people that we're supporting, informing our delivery. But what we've done, I had a picture of it and I didn't show you, is we've just been donated a bus. Well, it's not a bus, it's a massive van. It's an old youth service van, if you know them, where the sides open out. And that will be, if we go into another pandemic lockdown situation, it will be the potential, if we can deliver therapy, of going out and delivering one-to-one psychotherapy for people in the van out in the community. It will be the possibility of doing workshops with people when we can get to that stage. So it's about thinking creatively. What we've noticed is that we've had a lot more referrals from the Merseyside region into our services. And what I've learned from this as a manager is the gaps actually that are out there, and how we're seeing that there are so many services that have not been able to function in the way that we have, for whatever reason that may be, and that we can support that. So from our organisation, it helps us understand the ways that we can collaborate with others to continue delivering. But enable communities to deliver as well, yeah, themselves. So,
thank you very much, Adele. Janine, any quick thought you want to share with us before we close for today?
Yeah, definitely. I think the main thing that we've realised as a local authority is enabling people to have their own voice, and utilising community mobilisation has been really key to getting some of the messages across. So I think as a learning point, we will be going back to doing that more often, especially in other public health issues that we will have, because when COVID's over, we're still going to have ill people in the community. So I think we need to carry on with that ethos of letting them have their own voice.
Thank you very much, everybody. This has been very enriching. I hope that we'll stay in touch for other initiatives. I certainly will be working on the topic in the coming months and years. So I thank the speakers, I thank the participants, and I would like to call the meeting closed, but just this meeting, and I hope the collaborations will continue. Take care, everybody.